In the mid-20th century, a highly successful plastic surgeon named Dr. Maxwell Maltz noticed a baffling trend in his practice. Patients would come to him with severe facial deformities. Maltz would perform dramatic reconstructive operations, and the physical results were undeniable. Yet, when the bandages came off, many of these patients would look in the mirror and insist that absolutely nothing had changed. It was a strict dichotomy. Some patients saw their new faces and instantly blossomed into confident, outgoing people. Others, despite having the exact same surgical success, remained entirely trapped by their old insecurities, acting like the recluses they were before the operation. Maltz realized that treating the physical body was often useless. If a patient carried an invisible, unhealed emotional scar, no amount of precise physical alteration would make them feel any different. We repeat this surgeon's paradox every single day. We try to overhaul our lives from the outside in. We force ourselves onto strict diets, we fake confident body language, or grit our teeth through procrastination. But as this diagram shows, trying to change your life with pure willpower is a structural mistake. That rigid inner circle represents your self-image, the internal blueprint of who you believe you are. The flexible outer ring is your external effort, the willpower you exert to act differently. You can stretch that outer boundary temporarily, but doing so creates immense psychological tension. Eventually, your willpower runs out, and you experience the snapback effect, violently returning to the exact baseline dictated by your inner blueprint. Relying on willpower to force behavior change at the circumference of your life is futile. To achieve lasting change, you have to re-engineer the blueprint at the center. To understand how to actually change that blueprint, Maltz looked to the mathematics of mid-century guidance and control systems, a field of science called cybernetics. Cybernetics relies on servo mechanisms. These are the mechanical, goal-striving systems used by early room-sized computers to solve equations, or by self-aiming torpedoes to track moving targets. Maltz realized the human nervous system operates exactly the same way. A mechanical servo mechanism does not think. It does not ideate or philosophize. You simply feed it a target, and it propels itself forward, making continuous trial-and-error course corrections until it reaches that specific destination. This means the vast majority of your daily behavior isn't driven by conscious choice. You are operating a built-in automatic guidance system that ruthlessly executes whatever coordinates it has been programmed to follow. In the human mind, your self-image provides those exact targeting coordinates. Your conception of the sort of person you are is the literal data fed into your mental servo mechanism. You rarely chose these coordinates on purpose. Most of them were built unconsciously during childhood, heavily influenced by the passing criticisms of authority figures, social rejections, and intensely emotional past experiences. Look at this representation of a guidance system interface. Your mental servo mechanism is entirely impersonal. It makes zero moral judgments about the targets you feed it. If your self-image holds the firm belief that you are a failure, the machine accepts that as the goal. It will actively steer you away from positive opportunities, sabotaging your efforts, specifically to ensure you successfully collide with failure. What we call self-sabotage is rarely a lack of drive or broken willpower. It is a perfectly functioning machine blindly executing terrible data. Garbage in, garbage out. Because willpower is the wrong tool to fight an automatic targeting system, the only way to change your output is to reprogram the coordinates, and the tool required for that is your imagination. This works because of a specific biological loophole. The human nervous system literally cannot distinguish between a vividly imagined experience and a real physical one. We see this proven in physical phenomena. Tell a hypnotized subject that a room temperature pen is a red-hot poker, and their body will physically react to the touch, sometimes even producing a localized blister based entirely on imagined heat. Because the physical hardware of your brain reacts to imagined reality as objective fact, imagination is the only scalpel capable of performing actual emotional surgery on your self-image. Stop attacking the circumference of your problems. Instead, spend 15 minutes every day in quiet, vivid, highly detailed mental visualization. Picture yourself successfully navigating the situations that currently cause you anxiety. Watch what happens to that internal blueprint. This consistent visualization acts as new software. You are feeding fresh, specific data into your servo mechanism, slowly overwriting the old limitations of your self-image from the inside out. Once the self-image is updated with these new coordinates, your brain automatically hunts down the positive goal. You don't have to force yourself to act confidently. The machine simply locks on and steers you there. True transformation doesn't come from fighting your own mind with gritted teeth. It comes from giving your automatic success mechanism a better target to chase.